Welcome back to another episode of Living Vividly. I'm Jackie Hedditch, your health coach.
And I'm Daphne Olivier, the unconventional dietitian.
Today we're joined by Megan Dupré. She's a nurse practitioner, and we're going to be talking about men's health.
All things men.
We love them. We're dedicating this episode to all the men that we love. So I think a common thing that we all, it might be a little bit of a stereotype, but we all see it in our day-to-day lives, is the men that we love don't necessarily go to the doctor very often. And that is sometimes putting off some good medical care that they need. How do you see men and women showing up differently whenever they come to see you?
So men are definitely more reactive, and they're going to show up once a problem has surfaced. And women, I think part of it is us starting to go to like a gynecologist when we were very young. So we're used to just like going to the doctor every year, and that's very different for men. So women are more, I guess, inclined to start going to the doctor for preventative care, and men are going to come when there's actually a problem, whether it's noticed by their partner or somebody else, or if it's starting to affect performance, whether that's sexual performance, work performance. So yeah, it's definitely different why usually men and women show up.
Yeah, I think most of the time when my husband goes to the doctor, it's because
You told him to?
tell him he needs to go get that checked out.
Prompted.
Yeah.
Very, very aggressively prompting.
Or I just call and make the appointment for him. It's usually the case.
That's probably the best way.
Yeah.
Because it'll still probably take I'll go to the doctor.
Like, hey, it's on your Google Calendar.
Make the appointment. Yeah.
Yeah.
That's probably
Yeah. The amount of men that come in, they're like, yeah, my wife told me that I should probably have a doctor or whatever.
I forgot who I was talking to. It was like yesterday. And they were like, yeah, my husband hasn't been to the doctor in like 12 years. And he said, well, I'm not going to go there. They're just going to tell me I need a bunch of stuff. And I feel like that's kind of a common maybe error in thought or fear that they might have.
Well, and quite possibly it's true that they will find, maybe
12
their
years is a long
blood
time.
pressure is high, their cholesterol is high, they've got some blood sugar stuff going on, but it didn't happen at the visit of the doctor's office. It's been happening and building for this decade plus that they haven't gone to the doctor.
Yeah, like fear of what might be going on with them.
Yeah.
Yes. And I mean, sometimes I'll tell patients this pretty bluntly, when they come in and I'm like, well, had you been to the doctor in the last 10 years, I wouldn't be like making 20 referrals for you, which is overwhelming.
Right.
And the chance of them actually going to like all these referrals is a lot less if you just like went once a year and you're like, okay, well, let's knock this out or let's knock this out.
Right.
It's overwhelming when you go into a doctor and it's like, oh, well, now you need a colonoscopy. Oh, now you're a diabetic. Now you need a diabetic eye exam every year and a foot exam. And now you're on 20 medicines. So yes, the point is prevention. The point is trying to prevent like a bigger problem from happening and catch it early and starting to have a baseline.
What are the most common medical conditions that you see that have been, that could have been prevented, that had been delayed diagnosis because they haven't been to the doctor?
So cancers, hypertension, cholesterol, undiagnosed diabetes, they're pretty much silent a lot of times. Like some patients won't notice that their blood pressure is high. Diabetes, I mean...
Until it gets really high, people aren't recognizing that.
Yes, because, hypertension, the symptoms are, blurred vision, headache, nosebleed. But a lot of times patient won't notice when their blood pressures are just like 140/90, which is slightly elevated. Diabetes, increased thirst, increased hunger, increased urination. Those are all just pretty vague symptoms that they can think are related to whatever reason. Oh, it's summer, so I'm like thirsty because I've, been mowing my grass a lot. I've been outside a lot. So yeah, a lot of these diseases can be silent for a long time. And so those are caught a lot just in routine blood work. Doing an A1C once a year and seeing that you're almost in pre-diabetic range. Well, I can tell you to start watching your carbohydrate intake and, following a diabetic diet. And then in 2 years, had you not come in, you're a full-blown diabetic, and now you're potentially on insulin. So just that little change, just going to the doctor once a year can make a huge difference.
Yeah, and just finding things on the front end, like, okay, so pre-diabetes is obviously fixable versus full-blown diabetes. So we can implement these lifestyle changes that can prevent things from getting worse if you go to the doctor regularly.
Yes.
Annually.
And once I always tell my patients, like once you are diagnosed as a diabetic, you will always be considered a diabetic. So if that's, any encouragement for patients to go to the doctor, because then you're having to do eye exams once a year, foot exams once a year. All of this comes with being a diabetic, being on a cholesterol medication, being on a certain type of hypertension medication to help protect your kidney, a baby aspirin. I mean, once you're a diabetic, there's so many more things that, you have to do.
Continue just to prevent these things from happening.
Other conditions, correct.
Well, and also with a lot of these preventative things, it's often due to lifestyle. And lifestyle changes aren't super easy. So if we can see, okay, like from a blood sugar perspective, because that's what I look at a lot. Blood sugar is kind of creeping up. It's been creeping up for a little while. And now if nothing changes, you will be pre-diabetic next year. Well, you have an entire year to work on that versus if you come in like, oh, A1C is 7.5, it's for sure diabetes. Everything needs to change now. It's a lot harder to make those changes, and it's a lot harder to wrap your brain around the fact that there's something now wrong with you versus when you can prevent it. It's a little bit of a different mindset for people.
Oh, yeah. I will have patients, they must just zone out. Like when I tell them, bad news, if you have this diagnosis or this diagnosis, and I will go into like a whole conversation about what lifestyle modifications need to be changed, and they call the next day and they're like, what did you say? Because it's just so overwhelmed. I feel like they black out because they're just so shocked.
You can almost see them glaze over.
Mm-hmm. And so they call and they're like, because it's a lot. I mean, it's a lot to absorb, and it's scary in a sense because people don't realize. I mean, now most of these conditions are very treatable. And I mean, you can get someone's A1C down now with like all these great medications that we have out now very quickly, but no one wants to have that diagnosis,
So I have an 18-year-old son. We have traditionally not done a good job of doing an annual visit, and that's my fault. But so at this age, like what would you recommend, not necessarily for an 18-year-old, but for a new man, what is the frequency in which they should be going to the doctor, and how does that change depending on if they've been diagnosed with something or you're kind of watching or paying attention to something?
Yeah, I mean, if it's a healthy adolescent, young adult, I would still say once a year.
Okay.
I mean,
so that's once a year is enough to be able to monitor and prevent things whenever things start to shift. You can see it once a year.
Oh, yes. And of course, if they have a slightly elevated blood pressure, you may want to say, okay, I'll see you back in 6 months. These are some lifestyle modifications. Watch your sodium intake. Make sure you're sleeping. Limit the caffeine, no nicotine, things like that. But yeah, for an average healthy individual, once a year, which, I mean, that's easy.
That gives you enough time so you have your labs and you can track things, because we don't, like whenever we're getting our blood work done, we have no kind of concept of what it's been doing if you just go every 3 to 5 years.
Yeah.
Just,
so to have a baseline,
have
going whenever you're healthy or whenever you assume you're healthy, that gives you your baseline, and then you can continue to track it from there.
I feel like we came out of the gates pretty aggressively. This episode, we love our men, and I think that there's just some things that they do that drive us crazy, and we want them to live a long, healthy life with us to torment us forever. So we're not trying to scare anybody, and we're not trying to bash anybody. I just feel like we need to make that pretty clear. Dustin, do you go to the doctor regularly?
I don't want to talk about it. I'm so scared.
You should be.
What's the right answer? Every day?
The truth.
Every day he goes to the doctor.
The truth? I don't have a PCP.
Okay, let me introduce you to Megan.
Oh, yeah, I don't remember the last time I went through like a regular doctor, because I went to an ENT for a while because I had sinus problems, had sinus surgery. Then I had allergy problems. So I went to the same place to do allergy testing and injections and all that. And then I had to have esophagus surgery. Then I had to have my heart checked. So I've been to all these different
Specialists.
And so like whenever I would have like a flare up and like a sinus infection, I would just go to the ENT instead of trying to get to a regular doctor because I already had access to that. So I felt like I was going to the doctor all the time, so I didn't need to get anything else checked because I feel like they would have told me, oh, you have
Yeah, so
diabetes.
that brings up a really good point. What's the benefit of having a primary care versus visiting specialist or even urgent care? Why is a primary care important?
So we're the provider that is going to send you to the right people. So yeah, you were there for various reasons going to these specialists, but I do find that men do that a lot. Like they'll just keep their urologist like as their primary care. Oh yeah, like he took care of that, or like, you know, I just mentioned that I had a sinus thing, so they sent me in some antibiotics or whatever. And it's important to see like a primary care because there's certain things that specialists don't do that are done in primary care. I mean, we have all of these guidelines and screening recommendations for ages that you're supposed to do, you know, every other year or every year or every 10 years. And a lot of specialists may not keep up with things that a primary care doctor, like our guidelines are. So,
Right. So a urologist may be looking at your PSA, but they're probably not looking at your cholesterol.
right.
You know, so you really kind of have to have that primary person
Correct.
that's looking at the bigger picture and then like shuttling you to the other places that are needed.
Right.
Well, so I think it's a good point to say that labs are, there's not like labs that when you say you're going to get labs done or blood drawn, that it's like all these things get done. They could be looking for like one very specific thing. And if they're not looking for this stuff over here, then they're not going to find it. And so that's why you need a primary care person to look at the bigger picture and determine if you need to dive a little bit deeper.
I don't know my blood type either. Is that bad?
Oh my gosh, so many patients ask about that. And I usually just tell them it's actually expensive and it's usually not covered by insurance. So to just go get your blood, like just go give blood, and then they send you a card with your blood type. That's the only way I know it because I donated blood in high school one time. But no, men tend to definitely use I guess the path of least resistance or like the easiest thing to do when it comes to, oh, I went to this specialist and he'll just knock this out. But I do find that some specialists, I mean, and some specific doctors will do more than I expected them to do, like as just a specialist and not just focusing on what we do. But then that can complicate things sometimes too, because insurance, if they're ordering it and we're ordering it, and then it doesn't cover it because it's already been done. So best thing is just to establish with the PCP. We'll kind of, you know, run the show in a sense, and then, you know, send you to whoever you need to see.
Kind of take the guesswork out of it for the patient.
So he also brings up a good point about labs. So if you're not familiar with the system, like if a man is walking in, I'll say age 35-ish, and they've never really gone to the doctor or been inundated with the medical system, it certainly could be overwhelming. You know, like, what doctor do I go to? Where do I get labs done? What kind of thing? Like, so what is your guidance for somebody? Like, how do you get labs? What do? You have to have a lab order.
Oh, yes. So you really, especially for men, have to make it very simple, efficient. So I have papers already printed. I circle where they need to go. It has the address. I tell them our lab that we usually use is right next door, and you don't need to make an appointment. You just show up. Your labs will already be there because it's interfaced with our system. Like, it's literally the easiest thing.
So they just need the order and the address. The order and the address and maybe an insurance card.
They don't even need the orders because most of the time I just send it electronically. So I'm like, literally bring your license and show up between these hours, and you know, if they need to be fasting or not fasting.
I do think today it's easier to do almost everything. You can book almost everything online. You can book your doctor's appointment.
Yeah, you can book an appointment for labs online, but I've had patients go to the wrong one and then they won't draw them because they have an appointment at the other place. So I'm like, just show up. Just show up. So, and you don't have to do anything. Bring your license. That's it. Your orders are already there. So, I mean, yeah, you can't get much easier than that.
I also think men, correct me if I'm wrong.
I will.
I know. I think a lot of men have this, like, they have to be strong and they have to be, you know, this macho guy. And going to the doctor and finding out something is potentially wrong with you is vulnerable. And maybe there's a fear element of not wanting to find out bad news or
appear weak.
Yeah, be sick and feel weak. And it's maybe a mental thing where I'm on this quest. Like, I'll make up symptoms sometimes because I'm like, maybe I have this terminal illness because my toe itches really bad. Like, I'll just go above and beyond trying to seek out the answers. And
see, I'll just sit there and hope I don't die.
Yeah,
it's like
so
if
opposite.
I'm having a heart attack, and I'll just be like, no, I'm not. Am I? No, I'm good. And then if I live for another 24 hours, I'm like, okay, all right.
False alarm.
Yeah, I definitely think that men probably ignore symptoms a lot more, and it could be knowledge deficit. It could just be denial. It could be, trying to appear strong for their family, whatever the reason may be. But I do find that symptoms are ignored more, and some of them are vague, like, oh, I'm just like a little more tired lately. Oh, I'm a little like short of breath when
That's
I'm
what I was going to ask. What symptoms should they be looking for?
Like, never
what
ignore.
Symptoms should be a red flag to say, okay, it's time to make an appointment?
Definitely a change in energy level, excessive fatigue, chest pain, shortness of breath, erectile dysfunction, blood in urine or stool. I mean, those are all alarm symptoms. Visual disturbances.
And I think kind of like you said earlier, it's easy for us to say, to
make excuses
kind of.
Yeah.
Like, not to sound like we're just making excuses, but it's easy for us to be like, oh, I was outside for an hour longer today, so I am going to be tired. Or I peed more today. So I don't know how many times I peed yesterday. What's a lot? Like,
well, and I think that's also important because men are less likely to disclose things just on their own. So you have to ask the right questions. So when you are seeing a patient, you have to ask very specific questions because a lot of times they won't just volunteer certain information. Because
Such
like I
as
said,
what?
they'll just think, oh, okay, yeah, it's not really a big deal.
They don't know that it's an important thing.
But it might be a huge deal. Like, you may be about to have a heart attack, but you're like, oh, I'm just like a little short of breath. Or
Well, and I think most men are not as, and correct me if I'm wrong, but not as in tune with the way that their body feels. You know, like their brain is function, and I'm, I guess, speaking more from a husband. Like, his brain is thinking about a
The
very
thing in front of him.
specific thing. Like, one track might be 2-track minded. Whereas if he wakes up and he's short of breath, he'll just be short of breath for a little while and not really even realize that it's a problem until I'm like, hey, are you like, this has not happened, I'm making this up, but like, are you having a hard time breathing? You know, to where somebody else might have to point it out and they're like, oh yeah, I kind of had short of breath, blah, blah. And then make a reason, kind of put a reason behind it. But I think they're just not as in tune to changes in how they feel. Whereas women change how they feel monthly. It's like constant roller coaster all the time.
yeah, so we're used to like,
Yeah, you're used to recognizing things that come up and you're like, oh, this feels weird, or this is not my norm.
we only know if it's going to truly affect us. Like, if I'm feeling nauseous, if I throw up, there's something off. If I pass out and not am just tired, there's something truly off. If I,
yeah,
it's got to
I
be
feel
a
like it
big-
has to be much
More
more dire.
drastic.
if my Achilles pops and I'm not just
You can't
sore,
just walk
sore
anymore.
ankles, yeah, that's the big, it's got to be something that's like, oh, maybe I should get this checked. Maybe.
Well, I mean, a lot of patients, they will have not seen a doctor for years, and they'll have like some type of emergency, like a break or whatever. They go to the hospital, they do blood work, or they do some type of scan. It shows an incidental finding, and then that's why they end up coming to see me because of some other.
Yeah. So is it important to have, this was because I've been in the medical like stuff for a long time. A long time ago, somebody told me that it's important to have a primary care doctor. In case you end up in the hospital, you have to have that person that's still kind of in charge of what's going on. Is that still the same case? Or do you have more like hospitalists now that are...
Hospitalists have become huge in the last probably 20, 30 years. So there are certain groups in Lafayette where the internists do, and I think maybe even some family medicine, but not a lot, rotate round on patients in the hospital. But then sometimes your doctor is not even going to be on call, so it's going to be someone else in the group. So
that's less important.
Yeah.
I mean, it's still important, but less of a reason to
right.
have a
And I think a lot of older patients probably still think that. So I usually like to tell them, like, okay, you're still going to see a hospitalist even if you go to the hospital. I think it just became too much maybe with like insurance demands and having to see more patients, and electronic medical record takes so much more time than paper charting. So you're seeing less patients in clinic. And so I think just it's the
Got
whole
too messy.
Mm-hmm.
Earlier, you said something about getting eye checks for diabetes. What is that?
Well, if you go to the eye doctor, they're going to do a retina scan. So diabetics can get diabetic retinopathy. So basically, diabetes, the sugar in all of your vessels, it can cause a lot of problems. So microvascular changes, so in your eye, in your kidneys, in your limbs. That's why people go blind. That's why they end up on dialysis. That's why they have amputations. So that all deals with microvasculature. So you wouldn't just like go to the doctor and be like, hey, check my eyes for diabetes. Like normally it's like you could go if you like see an eye doctor because you have just like, you know,
So if you have
bad
diabetes,
vision.
you're going to see like degradation in your eyes, or
Yes. So the eye doctor will pull up your pictures that he takes of your eye, and it'll show whether you have damage. And so if he sees that, then he's like, maybe you should probably get checked for diabetes. But most of the time it works the opposite way.
Yeah.
Like I would say, okay, you're a diabetic now. You need a diabetic retina exam once a year
just to keep up
to
with
make
it,
sure you don't go blind.
So
Yeah.
it's just because of the vascular damage. So we made an analogy many episodes back about how sugar was kind of like an abrasive thing inside of your veins. I'm assuming I'm having this visual of the sugar kind of scratching up the inside of all the
Like
veins.
sand.
Well,
Yeah.
and the microvascular that she's talking about is the very, very, very tiny capillaries that are at the end of every organ. So in your kidneys, in your liver, in your eyes, in your extremities, your toes, it's the very, very, very small capillaries. And so if sugar is trying to get through that, but there's too much sugar trying to get through those capillaries, then if blood flow isn't
Mhm.
productive in those very, very small areas, then those capillaries will just
Like
shut
clogging
down.
up the little
Yeah, so
baby
they just
straws.
stop trying to shunt blood through them, and so that happens in all of your, like I said, your extremities and your organs. So your eyes being one of them.
Terrible.
Yeah, and that's what I'm saying. People don't realize that diabetes is like a silent killer because it's just eating away all of these vessels.
And usually it's so
And you don't-
gradual that
you don't know it's doing that.
feel it. Like you
Yeah.
might feel
Correct.
like, I don't feel great, but I'm 5 years older than I was 5 years ago, and so that's probably
And you don't
why
start
I don't
having
feel
the
good.
neuropathy until there's already like basically permanent nerve damage.
Yeah,
So-
I've always wondered, and I'm learning a lot more lately, but I've always wondered how can you go so long not realizing you're diabetic? And it's because of these
You want to hear
things.
something wild?
Of course.
My dad has diabetes since 1996. And a few years ago, I don't remember why, but he was going to get x-ray of his foot. And, I think maybe he had an ulcer on his foot and they were x-raying it. And he has a pin, like a needle, stuck inside his toe all the way through. The bone has grown around it. It's been there so long, and he's never felt it.
Wait,
There
hold
you
on.
go. That's why you
like
have to
a
do
pen
foot
needle?
checks.
A pen needle, like a sewing needle.
I have so many questions.
I don't know if I have the answer, but he didn't feel it. And so
The full needle?
the full needle. So my suspicion, if I had to guess, he was shuffling around with his feet and there was a needle. I don't know why a needle would have been on the floor, but I mean, any kind of reason. And it went into his toe, and he doesn't have feeling in his toes because he's had diabetes for so long, and he's pretty well controlled. But yeah, the needle went in and he didn't ever feel it. I'm assuming it didn't bleed much. I don't know. But yeah, and it just stayed there. He didn't know to pull it out. And so now the bone has grown around that needle. So there's no getting it out. Wild, huh?
That is pretty crazy. But that's why we do tell diabetics to check their feet every night to moisturize. So like if your feet are super callous, they're more inclined to crack, and then,
Mhm.
you
It's an
know,
opening for
infection can set
infection.
in, and you don't want any diabetic foot ulcers or infections. Yeah.
That sounds terrible.
If that doesn't scare you enough to go to the doctor, I don't know what will.
So in addition to getting preventative health care, I think we really need to look at how much sugar we're consuming as a society. Like, there's so many lifestyle things that we just don't even think about because it's so normal. You walk into the gas station and there's just aisles and aisles of candy and snacks. The way that we are treating our bodies is really scary. So I think that just, even if you're not diabetic, really taking account of how much sugar and carbs you're eating every day in general is one way to prevent this.
I'm going to stay on the diabetes train. I have 2 questions. Do you get diabetes by eating too much sugar, or is it genetic, or is it genetic?
So I think a lot of people used to think that juvenile diabetes was actually genetic. That's spontaneous. It's type 2 diabetes is usually the one that runs in families. So if you already know that you have a predisposition for being diabetic, then you definitely need to start making changes early on.
There is actually a genetic component to type 1 diabetes because it's autoimmune. And so there is a genetic component to it where I've worked with people that have like 3 or 4 people in the family that all have type 1 diabetes that didn't start as type 2 and then transition to insulin dependent.
Right.
They're all type 1. So there's a genetic component to it. But if I'm going to answer your question, I would say diabetes starts from the body's inability to manage glucose, which is fueled by excessive sugar consumption, but not only from excessive sugar consumption.
Yeah.
So type 1 and type 2 diabetes are different. How? What is type 1 diabetes?
So type 1, you don't have the beta cells in the pancreas to basically produce insulin. So you have to like give yourself insulin.
You've lost all ability to produce insulin. So insulin has to come exogenous.
And type 2 is almost too much insulin?
So type 2, okay, so you can basically change your diet, say, and a lot of times for patients with type 2 diabetes. Like you just changing your diet for type 1,
yeah.
That's not going to work. Like you have to be on medication. And there's so many type 1s that are so hard to control. And if they don't want to do like a pump, I mean, it's so hard to control if you're not like doing.
You have to test constantly throughout the day.
Insulin, yes. And carb counting and insulin with meals. So usually I would send those patients to endocrinologists because they're more complicated. But type 2 diabetes, if that's any encouragement to come to the doctor, it is so very treatable now. And a lot of patients, since the medications are so great now, we don't have to even start you on insulin to begin with. It used to be like kind of a rule of thumb, like, oh, if the A1C is above 9, start them on insulin. We don't really do that anymore because the medications are so
there's
great.
Such a huge variety of meds, and lifestyle is a huge. Diabetes is often type 2. Diabetes is often a lifestyle disease.
Yeah.
I've heard Alzheimer's be called type 3 diabetes.
It's because of blood sugar fluctuations happening over time.
So that's another possibly preventable.
So if you don't have diabetes, you can eat too much sugar. Can you eat too little sugar?
No. No, I mean, we don't need sugar to survive. We have
30 grams of protein, 30 grams of sugar every single day. I'm just kidding.
30
The balanced meal.
of sugar.
So no, you don't need sugar. I mean, some foods naturally have sugar in
Right.
them.
I
but
didn't
as far
understand what he meant.
added
I'm like, are you talking
sugar-
about like hypoglycemia?
No, do we need like
no,
if I have like could I be eating like in my diet if I'm just eating veggies and meat? Could I not be eating enough sugar?
But don't the vegetables turn to sugar? Like they turn into the glycogen.
so it gets
starches.
complicated because there's sugar. Like I'm assuming you're talking about added sugar, like
Do I need
table
added
sugar. No,
sugar
you do
if
not
I'm
need
just
added sugar. No,
A decent.
no,
Okay,
no.
that's
Do you
what
need
I'm-
carbohydrates? I would say yes. We do need carbohydrates,
which turn into sugar?
which turn into blood sugar. But that's where it gets the conversation gets a little bit confusing if we're not real clear on exactly what we're talking
Right.
about. We do not need added sugar. We do not need any kind of honey. We do not need maple syrup. We don't need any of that in order to function well. We do need carbohydrates. It is in our best interest to have fiber, which is a type of carbohydrate. So I think carbohydrates are important, and certainly keto people would argue that, but in order for us to live a long, healthy life, we need we do need carbohydrates.
But
And-
carbohydrates can be fruits and vegetables, not blueberry muffins.
Correct.
That's
So
not the type of
quality and
carbs.
quantity are two real big things that we have to like tease out.
So I think when most people think carbs, they're thinking about the food pyramid and the grains and those things.
Right. So there's just a huge bucket of foods that fall under carbohydrates, where grains would be one. Really, what most people, when we're talking about carbohydrates and what needs to be eliminated, is more of the refined carbohydrates. So things like breads, pastas, crackers, tortillas, muffins, all of those things that are highly refined, because we get the carbohydrates without any vitamin or mineral or phytonutrient support that goes along with that. So, but if you wanted to eat, black beans and strawberries or even bananas, all of those things have carbohydrates, but they're not bad. We still have to kind of manage quantity, but the quality of those carbohydrates are very different than Ritz crackers.
Well, since we're on this topic, do you find a lot of patients there's just a knowledge deficit and they're like
Absolutely.
they're not like reading labels? Because advertisement is a great thing, and it's like, oh, this is healthy, or this looks cute, or this looks healthy or organic, and then you read a label and I'm like, okay, that has like 60 carbs in it. Like yogurt. Okay, yogurt's supposed to be healthy, but I mean, yogurt can be very high.
There are lots of foods like
carb
that.
and sugars.
I think personally, and this is a very strong statement, but I do believe this. If someone is diagnosed with diabetes, if they're not referred to someone who is going to help them manage lifestyle, I think that's medical malpractice. I strongly feel that way, because most doctors will say, the general thought, I think, is that they're not going to do it anyway, so why even try? So we'll just start them on medication. But I think that I've worked with so many people that have had diabetes for 5, 10, 15 years, and they're like, no one has ever taught me this. No one has ever told me anything about this. And so I think it's medical malpractice if you diagnose somebody with diabetes and don't send them, or at least give them the option to go to someone that can help them better understand how their lifestyle is impacting their disease process, because
Usually,
it's such it's a lifestyle disease.
Yeah, usually organizations will have some type of like diabetic educational program that usually comes with like a nutritionist, because it is important, especially for those who are non-compliant. Some people get diagnosed and they're like super motivated and they're like, I don't want to be on medication the rest of my life, and they're motivated and they're going to do whatever it needs to be done so that they don't have to be on medication. And a lot of them can get their sugar under control just by dietary changes, but that's also important to catch that early. It's much easier to get a diabetic under control who has an A1C of like 6.7 than someone who's already at a 10 A1C without any medication.
Yeah.
So a lot of times it's easier when they don't know, because then they have a lot of things that they can change, so you can get that A1C down and their blood sugar. But if they've been living with this for however long and they're still...
If you catch it early and there is an element of concern, I won't say fear, an element of concern, and they feel like there's a potential that something that they do is going to change it, they're much more likely to do it. Not everybody. Some people are just like, just med me up and I'm fine. I don't want to change anything about what I do. I'll still go to McDonald's every day. I'll still, drink sodas every day. I'll still do all of that. And I think that everybody should be given that option, though. For
men that haven't been to the doctor in a long time, what's the most common issue you see whenever you see them? Is it if we're going to go back to diabetes?
Usually if a man's coming in, it's probably ED.
Okay.
So that's the driver that brings them in, is the erectile dysfunction. And then you have to explore.
And is that a symptom sometimes of like
we
blood
really
pressure
want to
issues?
talk about diabetes today.
No.
Go back to diabetes.
Okay, but other than diabetes, can ED be a symptom of
medication? It can be a side effect of
like heart issues, maybe.
Yes, perfusion. Yes, but also mental health. So anxiety and stress and all that can definitely play a role in that. But yes, that is definitely a driver.
Okay, that's not something that a lot of people will bring up. That's another thing. It's like embarrassing things we don't bring up with our providers, but
they'll bring it up with their spouse usually.
Yeah, which is why they're like, make the appointment.
Then the wife will say.
Yeah.
But yeah, there's so many options out there now. Like, no one wants to have a colonoscopy. No one wants to do a prep. No one wants to think about something going up their bottom. Obviously, that's not like appealing. But there are other options. Cologuard now. Now there's a new screening test. Not really sure the name because it just came out. Yeah, that's the one where you poop in a box and
You do it at home.
Yeah.
I've done
It's like
that.
a take-home colonoscopy.
Yeah.
yeah. And then, so that's only recommended though if you don't have like a family history though. If you're just like an average risk patient. And some patients, you can do like yearly stool samples. That's not very common now just because I think it's becoming, I guess, more normal for people to do colonoscopies. And I think once they do the first one and they're like, oh, it wasn't that bad, then it's like, oh, okay, well, to prevent me from having colon cancer, which is the most preventable type of cancer, like I'm just going to do this because, I mean, it's still the gold standard technically. But they have a new test out that you pay like $700 for, and it checks for like all types of cancers.
Oh, yeah.
And anyone
I've
can
seen
do
that.
it,
What
but
kind
it's
of
recommended
test is
like
it?
50 and up. It's a blood test.
Oh.
So they mail you the vials or something, and then you just go to a lab and they'll draw it, and it tells you if you're like, if you have
It has
either.
markers for like every single cancer.
Yes.
That sounds like an anxiety attack for moi.
I know.
That sounds like something you have already done.
I have put it in my cart and then was like, better not. I don't think I can handle that. I love
have
a
12
test.
cancers.
Yeah, exactly. I have done every test. I love tests.
So it doesn't tell you if you have the capability of having the cancer. It tells you if you currently have whatever cancers.
I think so.
Okay.
I mean, I'm not 100% sure. I've literally, it's very new. Like, I think we just had a rep the other day come by and talk to us about it. But
Because that sounds great. I mean, if it's just you have cancer or you don't have cancer.
well, especially if you have a lot of cancer that runs in your family.
Yeah, my sister has had melanoma 3 times and thyroid cancer. And every time something comes up, she starts having headaches. She's like, I'm sure I have brain cancer. I know that's what it is. So she's kind of a hypochondriac like you.
But I feel like she has a reason to be.
Yeah.
Yeah, it's like medical anxiety is there for a reason. I mean, the reason why I'm obsessed with finding things is because I've had things. You know, it's not like I was
Yeah.
just like one day a hypochondriac.
Yeah.
But yeah, that
So
would be nice
if
for
my
people.
sister finds out about that, she will absolutely have that test done.
Yeah. Well, I definitely felt like I was going to because remember when I had saved my eggs and then like my prolactin was high. So then they had me going to like every specialist and I'm like, oh my gosh, I feel crazy. Like I was going to literally a neurosurgeon, ophthalmologist, endocrinologist,
Because that is an indicator that you might have
a pituitary tumor. Which I didn't. My pituitary tumor was just a little enlarged and lopsided. Like the
your
stalk of it.
pituitary gland was enlarged, not
No.
the tumor.
The pituitary, I think my stalk of the pituitary was enlarged and lopsided, but it's so close to the optic nerve that it can cause blindness. Remember? And
I do.
And so I went and I failed the test, but I think it was because I was so aggravated because they didn't like tell you what was going to happen and you're wearing these things and it's like lights flashing and I'm like, you almost feel like claustrophobic. And so you're supposed to press every time you see a light. And so I think I just got like tired and
pressing.
annoyed. And then so I thought the test was over and they're like, now moving on to the left eye. And then that was like, threw me over the edge. So then I failed and then I had to go back like 3 months later and then I passed. And I'm like, yeah, because I knew what to expect. Like, I think a lot of it is just like error from the test because you're just like annoyed and scared and like, okay. Flashes of light.
That reminds me, my daughter failed her hearing test a couple years ago, and she just sat there through the whole test and didn't click the button one time.
They were like,
she's super deaf, and I was like, well, that explains a lot. Like, she never responds to me. She's always
super
ignoring me. So we had to go to all these hearing specialists, and she passed them with flying colors, but she didn't understand that she was supposed to press the button, so she was just sitting there like.
Man, this is a lot of.
well, then your like brain starts playing tricks on you.
Yeah,
It's
she's like, maybe I heard it.
Yeah, did I see a light or am I just like imagining this now?
I feel like we have to test everything twice to be sure.
And then I just started like click, 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 click. I mean, because they were so I'm like, I'm going to have to get
That's
some
like
of these
when
right.
you go
know?
to the eye doctor and they're like, which one do you prefer? This one or this one? And you're like, I don't know, first one. I don't
Yeah,
know, second
They're
one.
the same.
First, second. Doesn't matter.
God, I've been doing that my whole life. I'm so blind.
I know.
Good stuff. All right, bye.
No, you gotta ask a question.
Are we ready to wrap it up? You have no more questions for the doctor, the nurse practitioner, before we wrap it up?
I'll save it for my appointment.
Okay. Well, before we let you go, we ask all of our guests one important question is, what does living vividly mean to you?
I think it means being present in all aspects of your life. And when you're present and aware, then you can be more intentional and take control of your life.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.